Hello and welcome to Meet the Practitioners on HealthAfrik, and on this program we discuss issues related to pregnancy, maternal health as well as early motherhood. And today we are exploring family planning and contraception. Remember, this program is brought to you by the Association of African Universities in collaboration with the Center for Pregnancy and Childbirth Education. Currently with increasing awareness of reproductive rights, the need for accessible and accurate information on family planning is very, very crucial. And also, despite the various availability of contraception method, a lot of people still lack the knowledge of the best options. That is why today we are exploring the topic, and we are hoping that by the end we have contributed to raising awareness about the importance of family planning methods, and also, encourage open dialogue among family. My name is Isabella Tetteh, your host. We'll go for break. When we come back, I'll introduce our guest to you and start the discussion. Please stay tuned. You're welcome back from the break, and this is Meet the Practitioners on HealthAfrik. If you just joined, you can follow the discussions on our social media handles at Association of African Universities on Facebook and YouTube. And today we are going to talk about family planning and contraception. And we are glad to have you with us, helping us with the discussion, Dr. Eric Otu Tetteh, who is an obstetrician-gynecologist from the Korle-Bu Teaching Hospital here in Accra, Ghana. Hello, Doc.
Hello, Isabella.
You're welcome to Meet the Practitioners.
Thank you.
And thank you for honoring our invitation to be here. Okay. Right, today we are talking about family planning, and we know it's very important, especially since now we know about there's an increased awareness of reproductive rights. A lot of people are going in just to look at the number of children they bring into the family and all that. First, tell us, when we talk about family planning, what is it at all?
Yeah, so thank you, Isabella, and thank you, those of us who are listening and watching us, wherever they may be. So when we say family planning, family planning basically means the ability of an individual or a couple, okay, to achieve their desired family size, the spacing, the timing of the birth, okay? And the vehicle to achieve this is the contraception and treatments of involuntary fertility. So basically, that's what we mean by family planning.
Yes. The ability to decide the number of...
Yes, to achieve the desired number.
Right.
Of your family size, yes.
And now talking about the vehicle, that means there are types of vehicles available to help you achieve that. So what are these methods available?
Yeah, so when we talk about the contraceptive methods, there are a number. So we have the natural, family planning methods, or what some will call the fertility awareness method. And then we have the hormonal methods. Then we have the intrauterine device, which is properly called the IUD. And then we have the barrier methods. Then we have the emergency contraception, okay? And then we have the male. Most of the times we tend to forget about the male contraception, but there's also male contraception available. So these are the various methods of family planning or contraception that we have.
Okay, so someone who lacks the knowledge of these various will ask, what at all is it? Okay, you've mentioned a lot. Can you tell us how they work, how effective it works? Maybe for someone, this may be the best option for the person, or this other option.
Yes, so family planning, so like I said earlier, it's not just to, as it were, prevent unwanted pregnancies. It's also to help us to space. Okay, and then get the timing of when we want to have our children right. Okay, so the methods vary. So for the natural methods, yes, it depends. It relies mainly on the safe period of the woman, okay, to be able to know when not to have, sexual intercourse, so you cannot, or you can avoid an unintended pregnancy. And then the hormones, they are medications that we take, again, to prevent you getting pregnant. So you get pregnant only when you want to get pregnant. And then the other methods, like the barrier method I talked about, so those ones also prevent. And then the intrauterine device, the IUD, those are like, you know, little, you know, devices that we put into a woman's womb. Okay, that also would prevent the woman from getting pregnant. And then the emergency, which most people call the after pill. So that one, yes, when you have an unprotected sex, you don't want to get pregnant, then within a certain space of time, you take it to prevent you getting pregnant. And then the male contraception as well. That will go for our males so that they don't feel left out when it comes to family planning.
Oh, really? Okay, so if you say prevention, how does it work? Is it that it prevents we know that when you talk about pregnancy, is the sperm and then the egg coming together to form a baby. So when you talk about prevention, is it that it kills the sperm when it enters, or it doesn't allow the egg to come? And it'll just give us the science behind its effectiveness.
Okay, so I may have to take them one by one.
Okay.
So if you take the natural methods, like I mentioned, so the natural method is the woman using her cycle to be able to know when she is safe to have unprotected sex, so that she can avoid unintended pregnancy. So meaning that the woman would have sex only along
the safer period.
Yes, the safe period. So that tells us that the woman has to know her cycle very well. So these are for women who have regular cycles. So you are using your cycle to your benefit to prevent you from from getting pregnant when you don't intend to get pregnant. So that one, it solely depends on the woman. So her knowledge of her cycle comes to bear with that one. For the hormonals, they work by, so we have various types. I mean, if I'm sure with time I would explain. So we have various types, and it's taken by the woman. Okay, so it mimics how the cycle again goes, such that when she takes them, okay, it suppresses her from ovulating. When we say ovulating, from releasing the egg. So then she doesn't get pregnant. So if you talk to a lot of the women, they will tell you once they start taking the hormonal, sometimes there is a delay, or some of them don't get their menses at all because of the effects of those medications. Some would also make the inside of the womb very unfavorable. You know, when you have intercourse, the sperm from the man leaves and deposits into the woman. It has to travel. And on the way, it has to pass through the womb. So if the womb is unfavorable, the sperm cannot go. But just before that, you know, it has to go through the cervix. So the hormonals, what they also do is that they thicken, there's a mucus plug, in the lining of the cervix. They thicken it and make it just not accessible for the sperm to move, to go and meet the egg and get fertilized. And then for the intrauterine device, the ones that we put inside the womb, that's the IUDs, it also would create unfavorable environment such that the sperm cannot even move at all and also go. In that case, it prevents the woman from getting pregnant. And then the other methods I talked about, we have the permanent method too. So for the permanent method, this is like a woman who has finished her family, doesn't want to get pregnant again, but maybe one way or the other doesn't want to use either the hormonals or even her cycle. So those ones are permanent, means they are not reversible. So those ones, we have to use procedures. And what we do is that we take the tubes of the woman, and then we tie them. So that, again, it makes it impossible for either the sperm or the egg when it releases to come, so that they can meet to form the baby.
Right. You made mention men are also included. So how does it work with the men?
So the men always, it's the focus when it comes to family planning is always on the women. But the men are also there to help our women. So for the men, we have things like vasectomy. So vasectomy, basically, we try to take, you know, there's a connection, from the testes where the sperm is produced to when it is released. So that connection, we try to block it. So also tie it so that when the man has sexual intercourse, the sperm which is produced in the testes doesn't come, but the other accompaniments like the secretions from the other glands would come, but there will be no sperm in it.
And so it's also reversible. with the
that
men?
one is not reversible.
Wow.
That one is not reversible. For the men now, recently, there are, technology or advancement research into whether it's possible for men to also take like pills like women do. But these still are in the...
It's still in the process.
Yes, they are trying to find out. So, but for now, for the men, that is one. And the other is the use of the male condom. I'm sure it's popular with us. Yes. So, I mean, they can help. Although I know a lot of the men are not comfortable, but it's one way we can help because the condom is also, if used correctly, it's very effective.
It helps. I'm happy you mentioned that there's a process ongoing to decide whether men should take the contraception pill.
Pills, yes.
They need to experience the side effect of that pill. Now, talking about side effect, let's look at what are some of the effects of these family planning method. I have seen via social media, TikTok to be specific, a woman showing one of the implants, which was actually lightning, like as if you've touched a socket or something that it will shock you. It was sparking electricity and all that. So share with us some of the effects of the family planning methods.
Normally for the natural methods, yes, that one is because it's dependent on the woman. Most of the times, if you guess this right, there's no really any side effects as it were. The only effect is when you don't get it right, you get pregnant. But for the hormonals, that's where most of the contention is, most so the hormonals, let me just backtrack a bit. So we have the oral, so the ones you take by mouth, okay, like you mentioned, there are ones that you have to inject, okay, there are ones that we place beneath the skin, those are the implants, okay. And then there are ones that we put even together with the intrauterine device, we can put into the womb, okay? And then we have the ones that it's like a dermal patch, okay? So it can be placed on the skin somewhere, on the tummy, or even on the buttock of the woman. And then we have the ones too that you can place into the vagina, or like the rings. So these are the hormonals. And because they are chemicals, any chemical, like any drug, when you take it, has its own side effect. So I'll start with the oral contraceptive pills or the combined pills. So mostly what we tend to encounter, or women come to tell us, is that when you take the oral pills, sometimes it gives them, one of the chief things is that it gives you headache. So headaches, most women will come, headaches. So if it's your first time, you've not been introduced before, it can give you headaches. It can let you have nausea, okay? You can feel dizzy sometimes, yes. And these are the common things that we get, or the complaints that come in. So before we even put a woman on those medications, we do some, checks. So we take a history, we ask you certain questions to know whether you don't have certain underlying problems that can affect you or that can make those side effects worse. And I must say that every woman is different. So, and one other complaints that do come with the oral medications is that most of them say that once they take, they gain weight. I've also had patients who are coming that they take and they lose weight, and for them it's better. So you see, every woman and how their bodies will take those medications. Yes. But when we come, as I said, we assess you, and then we if those underlying things are there, we make sure those things are dealt with before you are put on. One of the other things that I've realized that most women don't go through that routine checks, but tend to take those medications based on recommendations from friends or sisters or mothers or relations, and that you may encounter problems because you don't know how that drug worked on whoever is recommending for you, and whether your peculiar situation, whether it may work the same. So it's always good for you to come to those who have been trained to really assess you by asking some few questions before you are put on.
Right.
To avoid those.
I'm really interested in this particular aspect of our discussion. So we'll go for a break. When we come back, we'll continue with the discussion.
All right.
All right, viewers, we'll go for a quick break. When we come back, we shall delve deeper into the types of contraception as well as its side effects. Please stay tuned. You're welcome back from the break. This is Meet the Practitioners on HealthAfrik, and today we are exploring family planning as well as contraception. Before we went for break, Doc explained what family planning is as well as the various methods available, and also discussed some of the side effects. Yes, we are going to continue from that aspect. Hello, Doc. Thank you for sticking with us.
Welcome.
Right, so you made mention that before you even take the oral contraception, you need to be assessed to know your state and how it may even affect you, impact or have impact on you before you take.
Yes.
Now, it's very common, especially among the youth. Immediately they are done with unprotected sex, they go to the pharmacy to get Plan B, just to prevent them from getting pregnant.
Exactly.
Is that advisable, or you still stick with being assessed before taking the medicine?
Yes, so I said that in relation to the side effects,
Yeah.
you know. Yes, much as we want it to be available and accessible, there are certain conditions or certain underlying problems with people that may, you know, trigger when they take those medications. Yeah. So ideally, every woman should be assessed individually. If I say assessed, so we ask you a few questions. A typical example is that some women may be walking even with high BPs, may not know. Yeah. And women with high BPs, we don't recommend that. So if you are just someone who just randomly walks into a pharmacy and buy, without knowing and checking that even your BPs are high, that may give you a bad side effect. Yeah. So it's always important that once it's a medication, the proper thing is that you are assessed well to know whether it is good. So that is why I said that. Right. But the side effects that we receive are things that come in, you know, regularly, that patients or our clients would complain about. Right. But that aside, I must also point out we also have some good benefits of taking those, which we call the non-contraceptive benefits of those medications. For instance,
what are the benefits?
Yeah, so we use these same medications, especially for women who have problems with painful menstruation or painful menses.
Oh, really?
Yes. Okay. So if you're a woman having painful menses, we put you on those combined pills. It can ease the pain a bit. And especially for those who bleed a lot, have heavy menstrual bleeds. Again, when you take them, it can correct. And then for women who have gone for like long periods of not seeing their menses, especially for an adolescent who starts her menses, maybe age 12, age 13, and then it's a bit erratic. So she has it maybe this time, it takes 2 months or 3 months. So when we put you on those, mind you, they are hormones, hormonal pills, so it corrects it. So all those things are, although those adolescents are not taking it to prevent pregnancy, so those are the non-contraceptive benefits. And then the last thing is that it also helps women who have acne. So you have acne, yes.
Really?
Yes.
Wow.
If you have acne, you take them. They're able to, yes. And those are some of the non-contraceptive benefits of those medications. So it's not all doom and gloom, like so the side effects.
Wow, this is news. You know, we can treat acne with contraception. Wow. Wow. Now you made mention of IUD. Let's look at the duration. How long should it last in our system before we go and remove it or reverse it?
So the intrauterine device, which is the IUD, when placed, so normally we place it in the womb of the woman. So when placed, can be there safely for 10 years.
10 years.
For 10 years. Okay. However, it doesn't mean that when we place it, then we've condemned you for 10 years. It has to be there. That's the fear. So a lot of women shy away. So if you place it today and next day you come that you don't want it or you've changed your mind, we'll just take it out for you. So it's not like once you put it there, there's nothing that can be done. But if it's put in there correctly, it can be there and serve as, you know, a contraception for 10 years.
Okay.
Yes.
Right.
Without no issues.
Right. I'm happy you made mention that is one of the reasons people fear. That means there are a lot of, you know, misconceptions about family planning. So you being the expert, share with us some of the things you've encountered. People coming to you, they said this, if I do this, it's going to do this. Like, share some of the misconception and myth around this.
Yeah, so thank you, Isabella. So there are lots of misconceptions when it comes to, contraception and family planning. Yes. And this stems, one, from fear, some also from religious and some cultural practices. So it makes it difficult for women and their partners to be on contraception. I always say that it's good and better, to prevent unintended pregnancy than to get pregnant and want to use means of termination. Because termination can end up even a woman losing her life. Yes, so it's always good. So I say that most of the time when you hear some of these things, the misconception, it's always good to see your doctor or any health person to explain it for you to understand. Some of the common misconceptions, especially when you take the pills or the oral pills, is that when you take the pills, you gain weight, like I mentioned. It is not true. It is not true. I always say that when you take the pills, it gives you peace of mind as a woman. You don't get pregnant. So that peace of mind can even let you gain weight. Yet you blame it on the pills, which is making you gain weight. And I cited instances where I've had patients who come in that their pill is making them lose weight, so they prefer it. That's one of the misconceptions. The other misconception is that when you are taking, it interferes with your fertility, so it doesn't make you get pregnant. So a lot of women, you see that they come and they're like, oh, this person said that they were on this method and they are not getting pregnant anymore. It's not true. Like the oral pills, once you stop it, your pregnancy or your fertility resumes immediately. It doesn't delay. However, the only thing is that the injectable, that I must say, the injectable that we give for 3 months, that one, even if you go in, the provider will tell you that sometimes it delays fertility for at least about 3 or 6 months. So they make you aware. But the oral pills don't.
It's just for that period.
For that period, and then your fertility returns. Some would also come in and say that, well, because some of the pills or the hormonals will delay your menses. So they say, okay, so if your menses doesn't come, it means it's gathering in your womb to find fibers. I'm sure you've heard about that. People say that. So it doesn't come. Where does the blood go? Because typically a woman, your menses should flow.
Come,
so if it doesn't come, then what? So they are afraid that, once they're on the pills or the hormonals and their menses don't come, it means they are developing fibers. So then they shy away.
But this is not true.
Oh, it's not true. It is not true. Some also believe that maybe you are taking the pills, you forget, and then somehow you get pregnant. And then once you continue to take them, it affects the pregnancy or it causes birth defects or even causes you to abort. There's nothing like that. We've not seen. So even mistakenly, you didn't take it correctly, use it correctly, and then you get pregnant. Your continuous take of those medications won't affect or give the baby birth defects. Those are some of the things why people shy away. The other is about, especially the IUD. People think that when you put in your womb, it causes cancer of the womb.
I was about asking that.
Yes. So a lot of women, when they come and you tell them about the IUD, they say, no, doctor, after the IUD, no, I don't want to, because I've heard that, yes, it's, the copper. And some people say that the copper will rust. So because of that, they don't want to have it. So those are some of the few misconceptions that are out there in the public.
This is very, very enlightening. So let's look at the role of social media. These days, instead of people going to the doctor to seek clarification and guidance and all, they rather rely on social media for information. And social media, some are to advertise on their product, some are to just give false information and all that. Just share with us the impact of social media when it comes to contraception and family planning.
Yes, thank you. So Isabella, social media has its good and bad sides. When it comes to information, because you don't know whoever put the information there, their motive for putting it there. So I always say that, yes, read about it, but always confirm or run it by someone who is professional to be sure about whatever information you are reading on social media, whether it's true or not. So when it comes to contraception, yes, we want the awareness. We want people to know about it. So it's good that social media can be a good tool, especially nowadays that we have statuses and all that people can and to raise the awareness. Because I might say that the contraceptive prevalence rate in Ghana is very low. Okay, although we think that we hear a lot, but the uptake by a lot of people is low because of some of these fears. So we can use social media to talk about some of the good things and to debunk a lot of the misconceptions. That's one way we can get. And then when it comes to the like the natural methods, well, nowadays a lot of my patients come in is that now there are apps that are available that can let you track your cycle so that you can know the safe period if you want to use the natural method and you don't want to use any form of medication, to be able to be sure, so that once you do it correctly, that can also help you from not getting pregnant when you don't intend to.
Right. Very, very true. Now let's talk about open dialogue among family. You know, when we talk about family planning, just as the name is between the husband and the wife, or boyfriend and girlfriend. Most times they do not involve the third or the extended family. But again, some two are not too comfortable discussing family planning with their, but let's take a woman who is career oriented and want to focus on her career and wouldn't want a child at the moment, but the husband too is willing to have a baby. So she, instead of having an open discussion, will just secretly go and do the family plan without the husband knowing. Share with us, give us motivation, some of the factors that can contribute to open dialogue between you and your husband, and if possible, the extended family.
Yeah, so I mean, when it comes to family planning, I always say that it takes two people to make a baby. So if the woman feels that maybe she's not ready or wants to space her children, because you see, there's a study that was done when women were asked that averagely, after having your baby, when do you think you want to have the next baby? And most women say that they want it after 2 years.
Okay.
But is that what is happening? The answer is no.
No.
Because it doesn't take only the woman. Obviously, it has to take the man. So much as it's the two of them that has to come together, you know, we always advocate that women feel free to talk about some of these things with their partners or their husbands for them to get in there. But because you need their support. Although the decision solely depends on you, you need their support, because in our setting or in our culture, the men have a very important role to play. So we don't want the women to always take a unilateral decision. So the best is to, you know, get in the buy-in of your partner or your husband, because, you know, there again, because most women tend to do that, because of most times when the pregnancy happens, the men tend to blame the women. So that's why sometimes you see that discussion doesn't happen, because of, you know, sometimes the burden that comes on the woman, you know, physical, emotional, sometimes even financial burden for some men who may not tend to be responsible. So ideally, you should discuss and get in the buy-in so that at least you are on the same page when it comes to family planning.
So still on open dialogue and then the support. Okay, now myself and my husband, we have agreed to go with the family planning for a duration because we are not prepared. But you know, when we talk about family, sometimes it extends to their parents and uncles and they are there. You are married, they are expecting a child to come and there's no child there. They start bringing the family issues and all that. With this, it will be very hard to even talk to your extended family that we are planning on doing a family planning, because they're going to say, hey, in our family we don't do that, we don't bring such things in our family. So share with us, encourage the extended family. Their support is really needed, especially when it is decided among the two couples.
Yeah, Isabella, thank you. But as I said, you know, a woman getting pregnant when she's not ready, okay, it's a lot of burden, not just on herself, on the family, on the society, and even the country at large. Because we've seen that majority of cases or pregnancies that are not intended or unintended pregnancies, about 50% of them, the women will abort them anyway. Okay, so this is for all of us to know, you know, to help. So when the woman is not ready, she's not ready. Or when the couple are not ready, they are not ready. We want the couple to give birth or to get pregnant when they are ready to do so. Because in the end of the day, they know their strength. Okay,
Yeah.
so they know how to manage the family and they know how to, you know, go about things. So if they say they are not ready, it's just for the extended family to support them.
Yeah.
And not to, as it were, you know, rubbish what they say and then just say because in our culture, in our this, because in the end, that may lead to a lot of unintended pregnancies and a lot of women will sort to unsafe abortions.
Yeah.
And that we know unsafe abortion is one of the causes of maternal mortality.
Exactly.
Yes.
Very
Yes.
true. And your support can be words of motivation, always checking up on them, and you know, accepting their decision, because you are not in the family to go through what they are going through. Thank you very much, Dr. Tetteh, for being with us here and also share the insights shared. You made mention of abortion. We would hope to have you here again to talk about terminating pregnancy and its effect. I hope it's clear.
Oh, yes.
Right, thank you very much. This is the end of today's episode where we discussed family planning and contraception. You know, we've explained what a family planning is, the various methods available, as well as its side effects, and then when to decide whether you are going in or not. Thank you for joining us today. My name is Isabella Tetteh, and this program is brought to you by AAU and CPs. See you again. Bye.